compassion in giving drug kits to drug addicts. I don't care what statistics anybody has. People are talking about, people come up here and go, oh, this person says they've lived in this community longer than this person, that person's a white supremacist because they took it from the Indians and da-da-da-da-da-da, and I lived here and I didn't live here, and I lived here since I was 4. And this is not the community I grew up in. I wouldn't take my kids to the park if they were young. I wouldn't let them slide down the slides. And for them to say, oh, you just have to go check for the needles first? Well, no, this isn't San Francisco. It's not LA. It's not Seattle. I don't want it to become that way. And that's why I will stand by the ban. And I will not negotiate for an exchange.
Their whole platform is this hypothetical situation in which kids are being pricked with needles, but there's been no children pricked with needles. And North Valley Harm Reduction is providing sharps containers, and they're coming to pick up any needle litter within a timely manner, so it's just fear-mongering.
There's a sociological concept called moral panic, I'm sure you guys are familiar with, very much so. That's all this is. I dug and tried to find out what the statistics were from kids getting stuck by random discarded needles, and I could find a lot of data on needle sticks in by cops and in the medical industry, of course. Couldn't find any concrete data around it.
We want to ban the needle handout because they're in our parks and people are having to get them out of the way for the children, and they shouldn't have to do that. They're all over.
I don't fear for my child. I don't think my ex-wife does this at all either, right?
No, that's my thing too, is these are people's children. We need to teach our kids compassion, and we don't get to pick and choose who deserves our compassion.
What it does do is provide a really good narrative frame for some pretty horrific shit. Because ultimately, this isn't against needles. This is against the visible signs of poverty. The nearby town of Paradise burned down. Almost 20,000 people wound up homeless or displaced. And our city has not built any affordable housing. They haven't kept up with their housing allocation as required by the state.
My name's Angel Gomez. I am a co-founder and the volunteer program manager for Northern Valley Harm Reduction Coalition. And we are an all-volunteer organization. And more recently, in November of 2019, we started offering syringe access and other harm reduction supplies. We have free HIV and Hep C testing on site. You get results in 20 minutes. We also do referrals, so if you were to get a positive result, we will connect you with a medical provider. We sign up people for Medi-Cal on site. We have tablets out there, so if people don't have health insurance and they need medical services, we can get that process started for them. We also have substance use counselors from a local program who are out there most weeks with us, and they're making connections with people, so that way if they choose to enter treatment, they'll see a familiar face, someone they know and have built a relationship with. We also provide hygiene supplies, over-the-counter medications. We have a number of different donated items, and we also have food available every week too. The fear and misinformation is disheartening. A lot of the information that people have isn't correct about our program, and it's fueling fear. There is information that we don't accept disposals, and that information is so prevalent in our community, even some of our participants weren't aware. They would come up and say, oh, you take them? I thought you guys didn't take them.
I get so tired of hearing people come up here and talk about the facts and the studies. And by the way, I have experience with heroin addiction, not me myself, but someone in my family. And I can tell you, I heard the word dignity. Oh my gosh, giving someone a needle, even if it's a clean needle, to put heroin into their veins is not giving them any dignity. Being high on drugs is not dignity. So I suggest you ban this.
Are they currently storing thousands of dirty needles in a storage unit instead of using an incinerator company? Because that is also against the law.
We're saying that the program helps the community. That's absurd. The vast majority of us, we have a zero chance of contracting HIV or Hep C. Why? We don't use drugs with needles, and we don't have unprotected sex with people that we don't know.
To ask yourself is, why in the hell do we have a needle distribution that's handing out needles like Mardi Gras beads to anybody that walks up without any questions asked?
Everybody to see my grandson. I love him. I want him to go to the park.
with NVHRC for over a year, and they formed in response to needs in this community, listening to people that live in Chico, and have developed a program in alignment with best practices. They have responded directly to community concerns by running syringe litter disposal and a syringe litter hotline. And syringe litter is not merely an issue of drug use, it's an issue of homelessness. And as much as people want to deny it, people are using drugs, and when people don't have somewhere safe to live or dispose of them, they may end up outside.
Last month, January, marked the 5-year anniversary of a massive HIV outbreak in Scotts County, Indiana, where 230 injection drug users were infected in just a few months. I urge other rural communities like this one to avoid the tragedy they endured by providing the proven public health intervention that is syringe access.
As a public health expert, I want to remind you that the main goal of the syringe access program is to reduce transmission of HIV and hepatitis C. Yes, we hope that people will get off drugs. Yes, we hope that other sort of things will happen. The average cost of HIV treatment is between $14,000 and $20,000 a year per patient. Half of all HIV patients rely on government assistance. I find it curious that people who say they value small government and fiscal conservatism are going for a route that actually is not cost effective. If we don't want people to get HIV and hepatitis C, we should make sure that they have access to clean needles.
I'm also a parent, and I understand that if I'm trying to keep my child from witnessing suffering and poverty, I will run out of places to go. I just wanted to take the rest of my time to really appreciate the community that I love that is doing so much of this work. You do this in the opposition that came here tonight. You do this without resources, and you do it with full-time jobs and with all this hate around you. And I can only imagine what you could do if you were supported by this council and this community.
We've only been providing sterile syringes for 3 months, and we have so many ideas and ways to improve, and we're really looking for support. And I just want you, I think the most that you could take away is that we're open to discussion given the chance.
Excuse me.